Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us to Healthy Living, it's round 2 of our discussion on fight medicine. I had fun writing this up, obviously. Yeah. Well, before we get to our viewer questions real fast, we did want to touch on some crazy concussions and knockouts that we've seen. And, you know, it just seems so scary watching it, I guess, from a woman's perspective. But what do you recommend for people who may have gotten knocked out in the ring?
To get out of the ring, because as you know from Muhammad Ali, the more times you get hit in the head over and over and over, the more brain cells you injure, and you may not be able to walk or speak later on. So really consider whether it's worth it. But the national guidelines for concussions go like this: if you are knocked out for once, you may return maybe after your concussion has healed after a few weeks, meaning you don't feel dizzy anymore, you don't have headaches anymore, your concentration and thinking ability is back to normal. You may go back, but avoiding injury. Once you've been knocked out twice in 6 months, you really should not do that anymore for quite some time and be checked by a neurologist, especially if you've had something like a seizure or been out cold for quite a long time. Definitely shouldn't do that anymore.
Okay, well, let's get to some of those viewer questions now. Jared from Manila asks, I've been training at a gym lately and went to the doctor and was told I have a staph infection. I was embarrassed to ask what caused it, but I guess he's assuming he got it from the gym.
And it's very common. In fact, there are guidelines on this in gyms as well. So there's something called MRSA, which is a type of very resistant, dangerous kind of staph infection that people can pick up. And they do here on Guam. I see them every day, where they've got a boil or a sore that's kind of really bad and it's not responding to normal antibiotics. And where people carry this bacteria is in their nostrils, because staph loves warm, moist, dark, and airy places, so that's right up your nose. And so if you have a sore someplace, you may go like this, and now it's on your hand, and it's back up in your nose, and so on. You're passing it back and forth and shedding it on other people, especially men that are hairy. They've got a little bit of hair, they're carrying it on their hair, and then they're wrestling, and it's being spread around and being spread around in the gym. So the staph, yes, it's very common in wrestlers and people who work out in gymnasiums. So all of you that go to the gym, please wash inside your nose, use a little triple antibiotic inside your nose to kill off bacteria there. And if you do get a boil or a sore, please wait until that has healed before you go back to the gym.
I would just be spraying Clorox everywhere.
Well, yeah.
All right, John from Timoning asks, how should we clean the mats we use for sparring? How often should we clean them? Speaking of Clorox.
Speaking of Clorox, yeah. So when you mentioned the spray bottle, to clean it again, you need to do something bactericidal, which means it kills bacteria, not just wipe it down. And so that's 10% bleach solution. Now, household bleach, you would take 1 part of that and 9 parts of water, so 1 cup of bleach and 9 parts of water, and then that'll be active for only a couple of days in your spray bottle. And when you spray it down, you need to leave it on the mat for up to 30 minutes before everything's dead. Clorox wipes work okay, but oftentimes, they're too dry. So you could use that in a pinch. But basically, creating a new spray bottle every day is important. And the other source in gyms is the bathrooms, because those tend to get very dirty. So cleaning the mats every day with your Clorox and the bathroom.
All right. Chris from Chico asks, I injured my wrist during training and I'm wondering how long before I can get back into it.
Depends on the type of wrist injury, Chris. If you just simply sprained your wrist, meaning you fell on it, it's a little bit swollen, but you can still wiggle it and it's okay, it doesn't hurt you. Typically, if you tap on your wrist and that really hurts a lot, or you can't wiggle it, then it might have a hairline fracture and you really do need an x-ray. If you broke your wrist, you'll be out for probably 12 weeks. If you just have sprained it, then it might be a shorter period of time, 2 or 3 weeks, and your treatment there is going to be resting it, icing it, and taking some Motrin.
Okay, Jesse from Jonia asks, I got punched hard in my left eye several months ago and have been having blurry vision since. What should I do?
Right. So that one could be due to your eye or sometimes your brain if you were injured hard enough, if you were hit hard enough in the head. Blurry vision's one of those, double vision's one of those symptoms of brain injury sometimes. So you would definitely need to get to the clinic so you could be assessed by a physician.
Okay, Vince from Agate asks, can caffeine enhance my training performance?
I don't think so, really. I think caffeine will a short-term rev you up or make you slightly more alert for a very short period of time, but it will bottom you out really quickly after that. So caffeine really isn't like the sports drink that's going to somehow enhance you. What will enhance you is lots of water and lots of training.
Okay, awesome. And our last question comes from Vanessa from Sanahanya. I'm interested in getting into MMA, but am worried that it may impact my ability to have children, because we are seeing more women get involved now in
It's
jiu-jitsu.
it's true. And you know, that's a great question. I think if you're getting a lot of abdominal injuries and you know, kicked in the stomach and those kind of things, that's probably not very good for you as a woman. I think I would have to learn more about that to be able to answer that question for you.
All right. Well, thank you so much, Doc. You are the heavyweight champ of all health-related issues, so thanks so much for coming.
Okay.
And Doc will be back again next week when we will pick up another healthy living topic. Make sure to stay with us. Stay tuned.
Thank you.